100, you could expect to live 47 years. If you're born today, you can expect to reach the age of 80. A full 25 of those additional years can be attributed to advances made by the science of public health. Public health scientists are responsible for revolutionary changes in how people eat, work, heal, and grow in our world. In 1854, a British doctor named John Snow traced a massive cholera outbreak to one well in a suburb of London, the world's first epidemiological study that prevented hundreds of deaths. Scientists discovered microorganisms which led to improvements in sanitation and hygiene. Alexander Fleming discovered penicillin, the first antibiotic. Jonas Salk gave us the polio vaccine, and today we have safe and effective universal childhood immunizations. Modern pediatrics helped inform best practice in prenatal care, and Dr. Virginia Apgar forever improved the health of newborns by developing a risk screening to assess their health in the first few minutes of life. Family planning became an option when researchers and advocates like Margaret Sanger developed safe, effective birth control options. And Ina May Gaskin promoted natural childbirth as an antidote to the medicalization of childbirth. Almost done. Dr. Selma Caterman-Dritz was assistant director of the San Francisco Bureau of Disease Control when young gay men began rapidly dying from old-fashioned communicable diseases and rare cancers. Hers was the first clear data delivered to the CDC that helped shape the nation's understanding of HIV and AIDS. Dr. Richard Dahl was a British physician who made the link between smoking and lung cancer. Cigarette smoking is no longer an accepted norm. It's the #1 preventable cause of death in the U.S. And finally, Mamie Phipps Clark, a psychologist in Harlem, provided evidence that African American kids internalize negative messages about themselves from a very early age, and that continued segregation enforced those ideas. Public health scientists have successfully helped us live longer, healthier, safer, more equitable lives. Let's honor the men and women of all races and backgrounds who helped turn a hunch into a hypothesis into a discovery, and countless discoveries into medicines, treatment, prevention, and laws that save the lives of generations of the public, all people, everywhere.
That's right, we have seen incredible advances and life-saving technologies in medicine, but why are so many of us still left unhappy and unhealthy? The social determinants of health, where you live, what you do, who you have in your life, the hardships you may have experienced, the opportunities that you face, addressing these can transform health. Not by my prescription pad, but through public policy and political engagement from all of you. You are the solution. I think about my patient, a young woman with 2 children, a job-ending car accident, suffering physical and emotional pain. First, antidepressants, then Vicodin, then fentanyl, then heroin. With access to mental health services and drug treatment programs, she can turn her life around. I think about my patient, an older man with chronic lung disease, in and out of the hospital for expensive interventions. But he's homeless. He doesn't have a safe place to sleep, to keep his medications, to cook healthy meals. When will I be able to prescribe safe, supportive housing as his most effective treatment? About the many thousands of our patients, the many thousands of you who have now accessed, some for the very first time, to high-quality health care through the Affordable Care Act. The Affordable Care Act saves lives. It provides access to care that we desperately need, and no matter who is in control in Washington, we will fight for the Affordable Care Act. We will protect and perfect the Affordable Care Act. Again, we will protect and perfect the Affordable Care Act. Are you with me on this? Are we going to do this together and fight together? Healthcare is a human right. Let's do this together. Thank you.